Hello everyone, my name is Elise Kelly. Today we will be talking about amyotrophic lateral sclerosis, also known as ALS. Today we'll be discussing the disease itself, a little bit about it, and what it's like to exercise if you do have ALS. What is ALS? ALS is a neurological disease in which the nerve cells break down. These motor neurons that break down are responsible for voluntary muscle movement. So voluntary movement is things that we have control over and we are aware of. So this is things such as chewing, walking, talking, and breathing. ALS is a progressive disease, so that means that it'll get worse over time. And it's also known as Lou Gehrig's disease. Lou Gehrig was a famous Yankee baseball player who was forced to retire due to ALS in 1939. He gave a famous farewell speech to baseball when he could no longer play anymore, and he helped to spread a lot of ALS awareness and continues to have an effect on ALS today. So here's a picture of a nerve cell. To the left is a healthy motor neuron, and to the right is one affected by ALS. So you can clearly see that there's an atrophied muscle with the side with ALS, and the nerve is a little more damaged versus the healthy side where everything just looks more normal. So there are two types of ALS. There's sporadic and there's familial. Sporadic is the more common form, and this accounts for 90 to 95% of all cases. Familial is inherited from the family. So if this type does run in families, the offspring have a 50% chance of also having this genetic mutation. And this only accounts for 5 to 10% of all cases. So who gets ALS? Anyone can get ALS, but there are populations that have a higher chance of getting ALS. For example, age has a huge part in it. It can occur at any age, but is more common between ages 55 and 75. Gender. For gender, males are more likely than females to develop ALS. And for race and ethnicity, Caucasian and non-Hispanics have a higher chance of developing ALS. So here we have a nice chart to show who has a higher chance. So the male line is the solid line. So you see that males have a higher incidence of ALS than females. And also the peak age on this chart is about like between 65 and 74, but there's also a lot between 54 and about 75. That's where there's the most data. So there are some signs and symptoms. Initial symptoms may vary between each case because ALS affects each patient very differently. Early on, individuals may experience trouble grasping or have changes in their voice. There's some other common symptoms like muscle twitches, cramps, tight or stiff muscles, and slurred speech. So here's a nice chart about the different symptoms for different parts of the body. Starting in the head and neck, we have impaired speech, excess saliva, difficulty swallowing, and lack of emotional control. For respiratory symptoms, we have shortness of breath, restricted breathing, and difficulty sleeping, which would be a result of the shortness of breath and the restricted breathing. For upper body symptoms, we have hand weakness, limited range of motion, upper body muscle spasms, troubles dressing and with hygiene, impaired handwriting, and difficulty preparing food. And for lower body symptoms, we have frequent tripping, difficulty on stairs, and weak feet. So scientists can break up the disease progression into 6 stages. These stages, starting with number 1, is the early stage. That's when the person is independent in mobility. They can complete ADLs, which means the activities of daily living. So that would include stuff like brushing your teeth, combing your hair, putting a shirt on, and just being able to cook yourself some food. And then they experience mild muscle weakness, which can cause slight limitations, but nothing that wouldn't allow you to function independently. For stage 2, there's moderate muscle weakness in some muscle groups. The reason we use the term some muscle groups is because it can affect people. ALS can affect people differently. Some people might have effects in their upper extremities before their lower extremities. So it depends on the individual. For stage 3, the person is still able to move, but there is severe weakness in certain muscle groups and difficulty performing tasks. So they might not be able to brush their teeth as well, or it might cause them a lot of pain. For stage 4, there's severe leg weakness, difficulty using arms, and they may be wheelchair bound by that point, depending on where the muscle weakness is, and it is hard for them to complete their ADLs or their activities of daily living. Stage 5, this weakness continues to progress. Mobility is now extremely limited, and an individual is bound to a wheelchair and has severe weakness in most muscles. And stage 6, the person is bedridden and requires assistance for all things. Feeding and respiratory assistance are likely required. So feeding tubes and respiratory assistance are required because the voluntary movements like chewing, talking, and swallowing are no longer able to be completed on their own, so they need assistance, and this would probably need additional care such as hospice. And a note, this is by a case-to-case basis because all cases are very different. So some people with ALS will have muscle weakness in some areas and others will have it in others. So it's just important to note that ALS affects all people differently. So diagnosing ALS. It's very difficult to diagnose this disease because there's not one clear way to diagnose it, and people experience such a wide variety of symptoms that sometimes the disease will go undiagnosed. There are some tests that they can do in order to diagnose ALS. This includes electrodiagnostic tests, blood and urine studies, a spinal tap, x-rays and MRI, muscle or nerve biopsies, or a thorough neurological examination. There is no cure for ALS, but there are medications and therapies that can aid people with ALS to make them more comfortable. There are medications such as riluzole to help reduce the damage to the motor neurons. There's edaravone, which slows the decline of the disease. And ALS patients may also receive OT, PT, and speech so that they can function to the best of their abilities. And physicians might also prescribe any other kinds of drugs to help lessen the symptoms because there's symptoms such as cramp, phlegm, and excess saliva that could be helped by certain medications. And breathing support and feeding tubes are eventually required for these individuals. So ALS and exercise. There is not enough research to understand how effective exercise really is for people with ALS. And since muscle weakness is very common for people with ALS, it is possible that muscles will be further damaged or overworked by exercise. So if people with ALS are exercising, it is really important that they aren't doing too strenuous of activities that could further inhibit their ability to function. Some experts actually discourage exercise due to the severity of the disease, but since it is a progressive disease, you could be able to exercise if it's early on in your diagnosis. There are some studies that say that light exercise may improve the ability to function. So for our case study, we are working with Joe Smith. He is a 57-year-old male. He does not have a family history of heart disease or any other cardiovascular issues. He quit smoking cigarettes 6 years ago. He has not participated in exercise since his ALS diagnosis a year ago. So he is sedentary. His BMI is 22.4 kilograms over meter squared. His blood pressure is 118/78. His blood glucose level is normal at 110 milligrams over deciliters. And his total cholesterol is normal at 176 milligrams over deciliters. And his HDLs are also normal at 55 milligrams over deciliters. So all of this information, this data is fairly standard. The only risk factor he actually really has is a sedentary lifestyle. So since these levels are normal, he is okay to exercise. His goals: he wants to maintain his independence because with ALS, it's likely that you will slowly lose it, so he wants to maintain it for as long as he can. He also wants his muscles to be strengthened to stave off the atrophy and wants to just improve his aerobic fitness as well. For exercise tests and the prescription, it really depends on what stage of the disease the patient's in. So they wouldn't really be appropriate for someone in the late stages because they wouldn't be able to complete any of them and they would be in a lot of pain. But since Joe Smith is in the early stages, he has the ability to complete some tests and some exercises. Some plausible tests for him could include the 6-minute walk test to test his aerobic fitness, the Robert test to test his balance to see how great of a risk for falls he is, and if he was at a great risk, we would have to closely monitor him. The 30-second chair sit to stand to see how his leg strength is, and bicep curls with a 2-kilogram mass. We could time that for 30 seconds to see his muscular endurance. But these tests should be supervised, and the exercises should as well, just because he does have ALS and there are risks and complications. So for aerobic fitness, we would select exercises with minimal risks of falling, such as a stationary bike. This just ensures that he's being as safe as he can when performing aerobic activity. And since our client was previously sedentary, we would start with 10-minute bouts 2 or 3 times per week. And then we could work up from there. We'd like to get about 150 minutes of aerobic activity per week, so we would want to increase from these 10-minute bouts and do at least 3 10-minute bouts per day. And then for muscle strength and endurance, we would do about 2 to 3 times per week as well. And we don't want to do too high of a resistance because we are worried about them further affecting their muscles and making them break down. So we would just do maybe 1 set for these activities. And for strength, we would do a weight that the client can lift 10 times. And for endurance, we would do a weight that they could lift about 20 times. And just to emphasize, the 1 set is just so we wouldn't cause any further damage. And for balance, we would practice this to help reduce the risk of falls and do this about 2 to 3 times per week. You could do things like standing on a foam pad while completing tasks or use a basu ball. It's just very important that this person is supported because we do not want them to fall while they're performing balance activities. And for flexibility, regular stretching, so about 5 to 7 days per week, would be recommended early in the disease diagnosis. And they may need assistance from a caregiver later in the disease progression because it might be harder for them to complete these stretches on their own. And deep breathing exercises can also be performed. Since the person will have respiratory complications later on, it is important to focus on breathing and make sure that you are breathing effectively. So there are some special considerations for people with ALS. Exercises may need to be adapted as the disease progresses because there will be more limitations that the person faces and they won't be able to complete exercises as effectively as they did prior. And the person who is responsible for their exercise program should be in constant contact with the physician in order to notify them of any changes or issues. Since ALS is such an aggressive disease, we have to make sure that people are keeping track of what's declining and what's harder for their patient. And heart rate, blood pressure, and exertion levels should be monitored just so that we know where the patient is and make sure they're at healthy levels. And since there's so many medications that an ALS patient could be on, we have to note the medications taken and when these medications are taken. So in conclusion, ALS is a very aggressive disease and it completely takes away all independence. If in the earlier stages, those with ALS can participate in exercise, but as they progress, it may be harder for them to complete these tasks. It is important to closely monitor the individual so that they do not fall or become too fatigued. And leading an active lifestyle may allow an individual with ALS to live independently for longer. Thank you for watching my presentation today.